Okay guys, this is Johanna. She's finished her second EBOO treatment today, and we're just going to talk a little bit about why she's seeking therapy with EBOO and what this has done for her life. So Johanna, why have you looked into ozone therapies and EBOO for yourself?
Sure. So about 2 years ago, I had COVID, and after COVID, I have been diagnosed with Lyme's disease. So I had traveled kind of all over the place looking for a place that offered ozone therapy, and I started off with ozone and was able to get somewhat of, my kind of like life back from that. And then was told by my practitioner more locally that there was a spot that had EBOO, so I decided to come here and try EBOO, and I had my first treatment last week, and then I'm just finished my second.
Yeah, so you've done a lot of things. You've looked into a really deep dive in the functional medicine space,
Sure.
into your thyroid, into co-infections and things like that. And so this is just, EBOO is not by itself the magic bullet. EBOO is like the best adjunct therapy that you can put with a good plan of care. So could you speak on a little bit the difference between, so previously Johanna was doing twice weekly ozone and ultraviolet blood irradiation, or O3 UV treatments. And can you talk about a little bit how that helped, and then compare your post experience with EBOO?
Sure. So I started off with about, like you said, 2 treatments a week for an extended amount. I think 6 weeks was what I started with, and that was kind of like a powerful punch in the beginning. You kind of described it like that to me, and that's exactly what it was with the ozone. A little bit of fatigue afterwards, headaches, kind of like more of that detox right away. And then going into the EBOO treatments, I had a little bit of that, but it was not as like powerful. I was able to just function and take care of my kids like a lot quicker than I did with ozone, just maybe because of that detox like component with it. So yeah, the EBOO was just a lot slower kind of transition into that, and I would say it even lasted a little bit longer.
Okay.
I don't know if that's like a good way to describe it,
Sure.
but I had more energy and it was more sustainable for a longer period of time. So that was one of the big things that I noticed with it.
And you recently went on a girls trip with your
Yeah.
daughter.
Yes.
And
Yeah.
were able to do things.
Yeah, we went to the beach for a couple days, just things that would not be even like imaginable or thinkable, like for me to think of doing previous to this type of treatment with Lyme, and a lot less body aches, energy, like I said, just the duration of all of that lasted a lot longer too, so I was super eager to come back in and like kind of get another treatment under my belt. Yes. And to go forward with that. So yeah, I was just able to get up a lot easier in the morning, less pain, just all of those things, like the energy, the things that you want to have, like, to feel like yourself again.
That long COVID kind of took away from you.
Absolutely.
Because before you had that, you were just a high functioning, busy mama, right?
Yes, yeah. I stayed home with both my girls full time, and after COVID, I went into that long COVID kind of realm and just started dealing with a ton of fatigue, headaches, you name it, I probably had it. So yeah, I'm just happy to kind of get over the hump of that and feel like this is really a key component in that. So
yeah, absolutely.
Eager to stick with it.
Yeah, and get that longevity. So yeah, when we're treating something like Lyme or long COVID, a long-standing chronic inflammatory condition, oftentimes we'll plan to do an EBOO once a week for 4 weeks. And maybe at 3 weeks you're feeling really good and we can space out your 4th treatment, but usually we really plan for 1 a week for 4 weeks, and then titrate a little farther out from there. And then, once this is really well under control, normal ozone and ultraviolet therapies can be resumed. But the reason that Johanna had an improvement in her less of a, it's not really a true detox or Herxheimer reaction, but the reason she didn't have so much of kind of being knocked down with EBOO as compared to a traditional O3 UV appointment is because EBOO is far more gentle to the system. It is a higher dose by far. It's more than 10 times the dose. But it is it's more gentle to the system. And EBOO, differently than O3 UV, will actually make your body absorb more of the oxygen that we're delivering to it. So your body is getting more oxygen and nutrients in those tissues that you wouldn't get with traditional O3 UV. Your microcirculation improves. So this is going to help with fatigue, organ dysfunction. With a lot of those chronic infections and inflammation, everything in the body is irritated. And EBOO is just a great, powerful way to reduce that inflammation, to support the immune system that's been struggling so hard, and then, at the same time, to eradicate any circulating bacteria, viruses, molds, all that kind of stuff. The beautiful power from the ultraviolet blood irradiation really helps to reduce feelings of feeling down and toxic kind of feelings. But it is normal after ozone and after EBOO to be tired for a couple of days. It is normal for your body, when it's killing all those bacteria and things in the body, your body has to filter that out. So it is normal to have those symptoms, but with EBOO, you get a much more potent therapy with a much more gentle recovery. So thanks for sharing your story.
Absolutely.
I'm sure we'll touch base after you've had your 4 EBOOs and see what's going on, but yeah, I really appreciate that. And give us a call, 574-377-6815 to schedule your ozone and EBOO consultation with me. Again, I'm Courtney Lawson. I'm a nurse practitioner, and I'll help you get your mojo back.